lifestyle and behavior are important parts of health, both prevention and treatment. Everybody knows this. They hear every day that they should eat better, they should exercise, that, they shouldn't stress out and relax, they shouldn't smoke or drink too much. This is common knowledge. But the question is, how do you actually make it happen in your life so that it's a natural part of your habits? It's not something you're struggling for.
Hello, everyone, and welcome to Get Well and Stay Well. It is my great pleasure to have with me today the guest Laura Pohl, who I've known for a long time and really enjoyed working with on many endeavors. But recently, in preparation for this FaceTime Live, found out a lot other things about her that I didn't know. Laura has probably one of the most experienced individuals in the field of integrative oncology. Remember that term, the integration of behavior, lifestyle, drugless approaches into conventional cancer care. Most recently, she's the senior researcher for a website called Beyond Conventional Cancer Therapies, which is a reliable, evidence-based website to get good information about things that go beyond what your oncologist often or usually talks to you about. One of those things is supportive care or palliative care, which she is an expert in and has been a palliative care nurse for many, many years, coordinated integrative oncology navigation programs throughout the country, works closely with Commonweal and the Smith Center for Cancer Care, and is one of the world's experts in the combination of nutrition and cancer care. Not just nutrition, so not just guiding you on what to eat, but she's also a certified health supportive chef, and has helped to put together not only what's good for you, but what is delicious. And I found out just recently she's also an accomplished musician and combines all three of those things into a new profession that I'll let her tell you about. Laura, welcome. Thank you for joining us. Really looking forward to having you here.
I am so delighted to be here. Thank you, Wayne. And I loved the photographs in the start of this whole program. It was really blissing me out. It was just beautiful. Yeah.
Well, we aim to bliss, so thank you for that. Laura, I'd like you to start off by telling our audience a bit on how you got where you are. I mean, the combination of cancer care and then supportive and palliative care, and then on top of that, integrative oncology, and on top of that, nutrition, and then music. How did that happen? Tell us a little bit about your personal journey.
Well, thanks for asking, Wayne. I worked on an oncology unit for probably about 15 years as an oncology clinical nurse specialist. And I also, in that role, worked in many areas of oncology care, including hospice care, as well as acute care. And over those years, I kept hearing oncologists and sometimes even oncology dietitians saying to cancer patients, well, it doesn't matter what you eat, just don't lose weight, eat whatever you can. And I'd look at those cookbooks from the National Cancer Institute, which at the time had these shakes, power shakes that were full of sugar and things like that. And I'm like, I don't know if this is really good advice. So I took a pirouette out of the hospital nursing and went on something of a sabbatical and went to the Natural Gourmet Cookery School in Manhattan to become a health supportive chef. And when I came out of that program, having answered now for myself why is it important what people with cancer eat? And I decided yes. I had an internship after culinary school, and my boss at the internship said, do you know Dr. Rachel Naomi Remen, who was for many years the medical director of Commonweal and the Cancer Help Program? And I said, yes, she's my Shiro. Why do you ask? And they said, well, how would you like to cook for her? She is coming with a group of physicians to do a workshop on recovering the soul of medicine. And we'd like you to cook because you're the only person here at this resort who knows how to cook a vegetarian diet. And it turns out that the group sponsoring this was Smith Center for Healing and the Arts. And once they met me, they asked me if I'd be the chef at their retreats. And it just went from there. And I know I'll talk more about Smith Center, but that's what I call my back door through the kitchen door story, because I wanted to work with Commonweal. I wanted to work with the cancer help programs. And if I had not taken that leap from hospital nursing, it would never have happened. Yes, so that's how I got started.
That's wonderful. So your work with cancer patients led you to an exploration, both professionally and personally, around diet, a major question that is asked by patients with cancer, their families in those areas, and it's still asked. Can you give us some guidance on how to sort out this morass of information? If you go online and if you talk and look around, your oncologist will still say, well, it doesn't matter what you eat. Often, not all of them. Some of them are getting enlightened and are actually getting some education themselves. That doesn't happen too much in medical school. But they will often say, well, it doesn't matter. Just don't lose weight. Just eat a balanced diet.
Right.
And there's guidelines. But then you'll equally, and if you go on the internet, you'll see equally with that, there is advocates for the Mediterranean diet and saying that's the healthiest diet, or low-fat diets, which you should get rid of the fat, or the opposite of that, which is all the rage right now, which is the ketogenic diet, which is where you get rid of all the carbohydrates, right? Or a lot of them, and eat mostly fat and protein and that type of thing. Can you help us sort through? I mean, is there a healthy diet for cancer patients?
Well, let me just start off with my 4 guiding principles that I've learned. And this goes for whether you have cancer or not. First of all, there are no real good or bad foods. Foods just give information. Now, that comes from the food psychologist, Mark David. And what that means is if we pay attention to what we eat and how we feel, both as we're eating it, right after the meal, maybe a few days, we'll get information from the food. And a real concrete example of that is if I eat soy, which I have a sensitivity to, I will immediately get very strong signals and information from that. And I will feel uncomfortable and have bloating and joint pain and even brain fog. So I take that information because it took me a little while to figure out what was doing that. And I choose to take that information as a sign that I don't need to be eating soy because I'm not going to feel good afterwards. So soy may be quite health supportive for someone else, but for me, it's not. So to be aware, there are no particularly good or bad foods. Foods give information, and that information may vary from one time in your life to another. A second principle I use is you can't eat dogma. So it may be that a Mediterranean diet, which overall I would say, if you had to pick one diet for overall health, including if you have cancer, a Mediterranean diet is a pretty good plant-based diet with a lot of the power foods that people look at in cancer. But it may be that at a certain time in your life that a different, maybe the ketogenic diet may have some indication in the kind of cancer you have. So you can't eat dogma. And if it's a craze, like keto, it may or may not be right for you, but people often come to you saying, when they hear you have cancer, oh, eat this food, don't eat that. Oh, I just read this. Here, check out this diet. And people just go crazy. So I often tell people to sort of just get quiet and centered in themselves, and you have kind of time to explore. And there are people who can help with that. For instance, I do something I call culinary translation. So I work with people who are looking at diets that are supposedly healthy, and I will work with their nutritionist or dietitian and find out what's the right diet for them, and then I'll help them translate it into real life and onto the plate. Another principle, and if you remember nothing else but this, it's from Michael Pollan, it's eat real food, not much, and mostly plants. And the diet that's typically recommended for people with cancer, for cancer prevention, preventing recurrence, is a plant-based diet. And we can talk more about that later. And the last thing I would say, I heard, my grandmother say this, eat your vegetables, right? So those are my 4 basic principles. And then you can go out from there. And I think we can talk more about that as we go.
I love those 4. I love those 4 principles. They reinforce each other in many ways, and also they bring in the link of the mind. So the mindset and the meal, you're saying, have to go together. It's not just about what's in this, which is what people focus on. Okay, what's in the particular food. But it's also how you feel, how you're aware, how it affects you as an individual. So combining the mindset and the meal, we're going to have somebody, I hope, on this broadcast in the future who's done studies showing how the attitude and how the mindset and how the social assumptions, the social dogma influence the impact of food. Sometimes even as much or more than what's in the food.
I totally agree.
On what's in the food. So pay attention to all of those 4 principles, especially if you got a lot of vegetables there. That's the one thing that we need to know. A lot of vegetables, real food, not something that comes out of a package. And maybe is highly processed, which is not
right.
a good idea. I've heard beans are really good, and I saw a study that came out of MD Anderson about 2 months ago, where they added beans, which is a natural food. A lot of good fiber influence the microbiome, which we hear a lot about today, and food influences your gut bacteria. Your gut bacteria influences your immune system. Your immune system influences cancer. And so, paying attention to that is important. But the ironic thing is it still comes down to the same principles, doesn't it?
Okay? That's right.
It comes down to the same Pollan principles of, don't eat too much, eat a lot of things that are real food, and especially vegetables.
Right. Absolutely.
Yeah. No, that's fantastic. I really like those guidelines and the way you've brought in the mind into that. Now, I understand that you've worked at Smith Center for a long time. This has sort of got you combining these areas. And then you went on to try to put together information through a new website called Beyond Cancer, Conventional Cancer Care Therapies, BCCT.
That's right.
And the idea behind that is to help sort through a lot of the confusion that cancer patients face. And you've done it in collaboration with Michael Lerner, who's well respected in this field and that type of thing. Can you tell us about that website and sort of how patients should, where they can find it and how they should use it?
Yes. So Beyond Conventional Cancer Therapies, and I like to say, is a website that helps you wisely navigate the world of integrative cancer care. And you beautifully described integrative cancer care earlier, Wayne. So it's integrating or blending together the best of evidence-based conventional cancer therapies with complementary therapies. And by that, we don't mean therapies that give out complements, but therapies that complement the conventional treatments, such as acupuncture, maybe certain vitamins, supplements, things like that, and also lifestyle practices. So BCCT gives some basic background on what is integrative care, what are some of the different types of medical practices that might use integrative care, how do you find an integrative practitioner or put together an integrative program. And then we get more granular and we look at the complementary therapies and we review them with an eye on the evidence, and so that the person's not just out there, oh, take this supplement, do this diet, and not knowing if there's a good evidence base behind it. And sometimes when you're in the midst of cancer, it's hard to discern and there's so much coming at you. And we also will say, what's the evidence in particular types of cancers? What's the evidence that it might be helpful across a number of cancers? What would be some of the cautions, including would this supplement interact with certain chemotherapies? So we have these therapy reviews, and we have over 80 of those. And then we have very long handbooks on the healing practices. And we take 7 healing practices, but you hear about these by different names. Ours are eating well, moving more, managing stress, creating a healing environment, sharing love and support, finding meaning, and I'm blanking on what the other one is. Oh yeah, sleeping well, of course. And so we really look at those healing practices and the evidence behind them to help with cancer. And all our reviews look at whether something helps during the treatment phase, helps to manage side effects or improve quality of life, helps to reduce risk of getting cancer or the cancer coming back, or optimizes your terrain. And I think later I'll talk a little bit more about ways to make your body less hospitable to cancer. So those are the types of things we have. Plus we have lots of stories of real people that they've submitted to us. And we hear and we believe that it's one of the most balanced looks at integrative cancer care that's out there.
Yeah, that's wonderful. Thank you for helping to put that information together. What I really like about it is it starts with just core information that everybody should know about that are not really controversial. They're in the guidelines right now, the major cancer organizations, the importance of nutrition, the importance of activity, the importance of stress management, social support in those areas. And those things, unfortunately, are not things that are discussed very often when you walk into your oncologist's office, because they are so focused on killing the cancer. They tend to neglect this thing that you're calling the terrain. And I think there's a core set. And then you go beyond that to ask some of the more challenging questions and also talk about, well, how to navigate uncertainty, because this is often a very uncertain area. We don't necessarily have good evidence for many of the recommendations,
right,
both conventional, complementary in those areas. So you have to be able to know about how to negotiate, how to navigate that process. But let's talk a little bit more about the terrain that you just mentioned. I think for the oncologists and for the medical profession, they use a different term for this. It's called the microenvironment, or the environment. And actually, we heard in the State of the Union address, the president talked about exposures from bird pits and things like that, and he implied that kind of environmental toxins might lead to cancer. And we know that there are a lot of toxins in the environment that actually contribute to a variety of diseases, including cancer. And yet, if you get cancer, it's still focused mostly on, well, let's kill that cell. It's sort of a late stage, et cetera. Tell us about the environment and how important the environment is, not only for preventing cancer, but even for managing and treating it, even if you have cancer. So integrating that terrain component in the microenvironment, what does that involve? And what do you mean by that?
Yeah. So, and it's interesting because terrain as a concept in medicine is pretty well accepted in Europe. and not so much here, although we're seeing it more, especially among integrative oncologists. But think of terrain as your internal environment in your body, and think of it as the soil. And think of cancer as perhaps a really pernicious weed. And you know, as you said, oncologists are focused on that weed or that seed, but they're not thinking so much about the person who is, in whom this weed or seed has taken hold. Or might take hold. So you have your internal environment, and what a cancer will do, so that now we're talking about the tumor microenvironment, so the environment around the tumor. The cancer will begin to take the normal cells in the environment around it and use it for their own purposes. So for instance, it has to have a way to feed itself. So it will work with the environment around it to create a blood supply to itself, and it will actually use some of your normal cells to do that. It's going to have nutrition like sugar or glucose to fuel its activities. It wants to spread, so it might do some work with the tumor microenvironment so it can spread along cell, the tissue. So you've got this environment around the cell within the human being. And I really appreciate Dr. Keith Block, who's has an integrative oncology clinic, the way he describes the terrain in his book, Life After Cancer, and how you can work to balance the terrain to make the body less hospitable to cancer. And a lot of people, Dr. Lisa Altshuler, who's a naturopathic oncologist, they look at this and they might have different words for what they do. So a terrain imbalance, I'll give you an example, would be inflammation, chronic inflammation. And many of us in today's society have many things going on that could make us have chronic inflammation. And this is different from the acute inflammation you get when you cut yourself or have a cold. This is inflammation that goes on, and those the chemicals and cells that come out in inflammation could be used by the cancer for its own purposes. So things that contribute to inflammation would be certain things in your diet, stress, not getting enough sleep, perhaps not being sedentary. It could be chemicals. There are lots of things can contribute to chronic inflammation. And so one way one would want to balance their terrain is to address inflammation. And one of the ways you can do that is with food. But there are many other approaches to it as well. So it's usually good to do a combination of approaches.
Yeah, that's wonderful. I mean, people understand when they talk about the importance of lifestyle when you're managing, let's say, diabetes or cardiovascular disease. They get it. We have programs set up to help people do that with those conditions. And what I hear you saying is that we need programs that do the same thing if you're diagnosed with cancer. Behavior and lifestyle changes in those areas. We have a set of tools attempting to teach oncologists and oncologist teams how to do that in their routine practice called the Hope Note Toolkit. And there's a whole network of leaders in integrative oncology and mainstream oncology that are beginning to apply and test these things out so they can become more widely available. One of the things that I hear you say over and over again that is so important and is that this goes beyond diet. Okay, this isn't just about the diet. That the environment of your mind and your social environment, your stress environment, is equally important. And I so appreciate that you kind of started your journey, or at least you started your journey in palliative care, nursing, but then you moved into integrative oncology through Commonweal and Rachel Naomi Remen's work, which so elegantly describes the importance of the mind and the soul in our own self-care. Instead of ignoring the fact that we have spirits and a mental body, it actually puts it right out front and says that's important. Can you talk to us about your work with Commonweal and the Smith Center, which is one of those centers around the country?
Right. So both Commonweal, which is in Bolinas, California, and Smith Center for Healing in the Arts in Washington, D.C. And of course, now with the pandemic, we know no geographic boundaries. We're doing all our programs virtually and reaching people, more people than ever. So we both Commonweal and Smith Center come from the viewpoint that healing is innate in everyone. And just to focus on the difference between healing and curing, curing would be removing all evidence of disease. And that's what everybody would like if they have a disease. They want to be cured from it. Sometimes that's possible. More and more often it's possible. But it's not always possible. But even when cure is not possible, healing, which is the recovery of wholeness, and that's, mind, body, spirit, can occur. And we all have an innate ability to heal. Just look at a bone heal after you break it, at a wound to heal. And we have a way to heal our mental and spiritual aches and pains and wounds. So this wound becomes an opening, as Rachel Naomi Remen says. So everybody has this innate ability to heal. And we find at our cancer retreats, for instance, when we have 8 people come for a whole week to explore healing, we often find that though cancer is what brings them to the retreat, is what sort of brought them together, what needs healing in their lives is very different from what they thought. They thought it was the cancer is what needs healing, but they focus on so many other things. Maybe it was their relationship, maybe it was a job that was really just stressing them out and practically driving them mad. So healing goes beyond curing. And that's our big focus at both organizations.
Yeah, that's fantastic. And you and I have both seen patients that have been cured but not healed. You can be healed even if you're not cured. They interact with each other, but they aren't necessarily the same thing. And also the root of the word healing is the same root word for wholeness, as you've implied, and holy. Holy. Which acknowledges the sanctity and the sacred part of all of us.
That's lovely.
I understand, there's a way to get at holiness that you have also cultivated and explored, and that's music.
Yes.
In those areas. Tell us a little bit about this new profession that you have created. I'm not going to pretend to say the word. You tell us the word.
Oh, yes. My boss at Smith Center at our retreats, she would start to introduce me as a chef nursian. So a chef, a nurse, and a musician. And I think my oldest profession is music, or not profession, but my oldest gift. I started singing when I was just a little girl. And speaking of healing, I had really bad asthma when I was small. And but I also loved to sing, and I would go around the house singing all the time. And my dad thought it was going to disturb my mom, who really liked peace and quiet. So he urged my sister and brother to keep me quiet. And my grandmother noticed that the less I sang, the worse my asthma became. And that if I went over to her house next door and started singing while she played the piano, I would get better. And then in 3rd grade, after several times of nearly dying from the asthma, I started taking piano lessons at my grandmother's urging. And I started singing again every day when I practiced, and the asthma went away forever. I've never had another asthma attack since then.
That is amazing.
Yeah. So I have to sing,
You have to sing to stay Keep your asthma away. Well, I don't want to silence you either. Any chance we could get a little song here?
Oh, sure, sure.
And then we'll field some of the questions that are coming in after
Great.
that.
Yeah, I see him coming. Great.
Let's take a little musical interlude here.
Yeah, so let me back up a little bit. This is my Martin guitar. It's been with me for many years. This song is just to honor the fact that healing is innate in every one of us. And we have a wisdom and intuition, whatever you want to call it, that will help you find what's right for you in your journey toward health. It's in every one of us to be wise. Find your heart, open up both your eyes. We can all know everything without ever knowing why. It's in every one of us.
Thank you very much.
Thank you
Really
for letting me
appreciate
say
that. Is that the kind of thing that happens at your retreats? If we come there, will we be able
Oh
to
yeah,
sing?
we spend one evening just having a little sing along after our healing circle. Yeah.
That's fantastic. Well, I do think we do have several questions in. Some of them we've talked about, but there's a couple I just want to finish up with you, if you don't mind. One is really about ethnic foods. You know, there are lots of types of foods around the world, and you know, some of them are not all that whole foods either, but they're still embedded in part of the culture. How do you go about making, you know, ethnic foods and delicious and nutritious?
Oh, thank you for asking. One of the principles I learned at the Natural Gourmet is the tradition of food. So eating foods that are from your tradition. And what they meant by that in the class was, if you look back to the people, your ancestors, and the food they ate in the old country, and you're trying to figure out particularly what beans and grains to eat, because you don't know, you're not used to that. Look at the beans and grains of their tradition, or whatever the traditional foods were, and chances are that's going to appeal to you. It's going to taste better. Maybe your genetics are set up better to digest and assimilate those kinds of foods. So if you're from Northern Europe, you know, white beans would be some of the beans of your ethnic tradition, and maybe rye and buckwheat and things like that. So that's a good place to look at honoring your tradition. I grew up in Southwest Louisiana, where we ate anything that walks, crawls, flies, swims, or jumps. And we tended to eat a lot of high-fat food. And I moved to Virginia, and I wanted some of those foods in my life, but I wanted to find a way to make them healthier. And I had the best time in converting a lot of these recipes into healthier versions, using a lot of the basic foods, or at least the basic seasoning ingredients. And I would serve it to my friends. I even cook it for my family down there, and they like it. So there's a way to do it. And at Smith Center, we were doing a project with African immigrant communities and African American churches on healthy living. And they wanted to make a cookbook of healthy soul food. In fact, they thought, oh, is that even possible? And I said, oh my gosh, yes, the roots of soul food are very healthy. And so I think if you really, you were talking about some ethnic traditions, maybe don't necessarily, they might still eat processed food, but if you really dig deep back into their roots, you can find a lot of health supportive foods and ingredients. And I'm happy to work with any of you with that. You come to my cooking classes at Smith Center, they're online. We have other chefs who do similar work. And there's lots of ways to do that. And Old Ways, I think, if you look up Old Ways, they have, I think, the African American cooking and maybe Latin. But if you go on there, you'll find some good ways of honoring ethnic traditions in a healthy food.
Well, that is wonderful, and I understand you have a cooking class coming up towards the end of the month there.
That's right.
At Smith Center, and we started talking about. There's the link to it if people are interested. We started by talking about food and how you got into food, but we've just taken a journey through what I would call wisdom. You talked about the importance of the soul. You talked about the importance of music and showed us a little bit of that. Thank you for that treat. And the wisdom of traditions that so often in our modern society where we're focused on, this molecular this and scientific that, we forget the wisdom and the wisdom of traditions that come from the whole person and the cultivation of the whole person and healing that goes along with that. Chef, musician, nurse, integrative oncology nurse, palliative care nurse, Laura Pohl, thank you for spending the time with us. And this is a rich interview, and I really appreciate coming on to Get Well and Stay Well with us.
Thank you so much for having me.